today for the special conversation session with the Honourable Mark Butler, the Minister for Health and Aged Care. You can see him there on your screen. We'll just take a few moments to make sure that everyone's here before the webinar formally starts. While we're doing that, we'd love it if you introduce yourself in the chat. Let us know who you're representing, whose land you're on, why you're here today, all of that. Always love to hear that. And later on the question, you will have the opportunity to ask the Minister questions. Some people have sent them in, but we do have a Q&A open. So if you haven't done that yet and you've got a question, feel free to drop it in. And if we've got time, we will also include those too. So we've got a few people join now, about 70. I've just made a couple more seconds. We've got nearly 200 people registered, Minister. So, you know, sometimes people register because they plan to watch it on the weekend. So we don't assume that they'll all come, but certainly some will be here. All right, I think we've hit over 70, so I'm going to start us so that we make best use of your time. So again, welcome to those of you that have joined us. I am just really thrilled to again have a special in-depth conversation with Mark Butler, the Minister for Health and Aged Care. For those of you that don't know me, my name's Elizabeth Deveny and I'm the Chief Executive of the Consumers Health Forum of Australia and hosting today. And you might have seen at the very beginning, we will be recording this and we'll put the link up on our YouTube channel later on for those that don't get a chance to watch it all today, get called away perhaps during the meeting or want to look at it again and again, perhaps, Minister. We'll wait and see. As we start, I'd like to acknowledge that I'm in Naarm today. And so I would like to acknowledge the Wurundjeri Woiwurrung people of the Kulin Nation as the traditional custodians of the lands on which I am meeting you from today. I want to acknowledge and respect their continuing culture and the contribution they make to the life of this great city and the region. I'd also like to acknowledge any other First Nations people who are on the call with us today. And so on behalf of CHF, it's my honour to have our special guest, Minister Butler, share with us some details of the recent budget and particularly what it means for health consumers. And after that, as I mentioned, we'll have a Q&A session. We've got people from everywhere here today, a lot of health consumers, but also people from various professional groups, policy groups and so on. Love to have all your questions. Just a reminder, we'll be focusing on those questions that particularly come from our health consumers today. If you've submitted a question, we've tried to theme them up. We've got lots of questions and hopefully then the Minister will be able to tackle those particular big issues that you've mentioned. If we don't get to your question today, we're still going to keep it. We will use it in ongoing conversations with the department, with the Minister's team, or perhaps even the Minister himself. So encourage you to put all of your questions in. If we don't get it to today, it won't be wasted. We will continue to advocate on your behalf for whatever the issue is that you really want us to talk about today. So I'll be moderating those questions. As I said, we'll get through as many as we can. We really want this to be interactive. So there's the chat there. People are starting already to put their names into the chat. Love that. Also, there are, where you see reactions down the bottom of the screen, you can put a love heart or a smiley face or an up or a down. I'd love you to test that button out now if you like and check that it works. Because in a moment, the Minister's going to be speaking. Look at those thumbs up, a party, love all of that. As the Minister talks to you at the budget, if you love what he's doing, give him some hearts and some claps and some parties. Now, we're your friends, Minister, but we are your critical friends. We're here to help. So if there's something that people don't like there, I would encourage them to give you the sad face or the thumbs down so you get a sense of what they really love and what perhaps they want more of or they didn't see enough of or they perhaps even don't like. So keep that interactivity up, folks, as we go through today's session. So I know that it's nice for you to all hear from me, but honestly, you really want to hear from the Minister. So I'd like to formally hand over to him, welcome him and hear from him about the budget. Thanks, Minister.
Thanks so much, Liz. You're able to thumbs up if you can hear me well. Great, excellent. Thanks to everyone who's joining us today for taking the time to have a conversation with us about the budget. Elizabeth said, you guys want to hear about measures that impact on consumers. My job is to remind myself every single day that everything we should do in health policy and program design and delivery should always be about consumers and should always be thought about from the perspective of consumers, which is why the work of the CHF is just so important. We rely heavily upon your work. We call on you heavily. I know as consumer advocates around the country, you are called upon all the time to provide a consumer perspective, and I saw it as a really important part of last year's budget to do all that we could to really lift the ability for CHF to support consumer advocates right across the country. We want to know, thumbs up, thumbs down, love heart, cross-face emoji, whatever it is, we want to know how these decisions are impacting consumers and, frankly, what else consumers think we should be doing. So I really look forward to this forum. I welcome the sort of frank and fearless feedback we've got from the CHF in the time we've been in government. And that was my experience when I dealt with the CHF when we were last in government. I was in the health portfolio for many years as well. So I value this relationship. I want to see the capability of the CHF maximised, our support for that, because we always want to know what we're doing is actually making the lives of consumers better. And you know, this is not just an issue for CHF. You know, one of the first things I wanted to do when I came back into the portfolio after the last election was to revive a piece of work I'd been focused on when we were in government last time, to put in place a consumer's body or a lived experience body in mental health. I'd funded it in the 2012 budget. It had gone nowhere for 10 years, and we're in the process of building that consumer capacity as well in a sector where, frankly, the consumer voice has not always been as loud as it should be. It's not always been as present at the decision-making table as it should be. So thank you for the work you do and for this frank conversation. Last week's budget, I think, well, I'd like to think, continues the hard work we've been going about since we were elected 2 years ago, as I described it at the election, to strengthen Medicare. You know, we're 40 years into Australia's most important social program. We can be very proud of what we've achieved. When you look at the global comparisons of healthcare systems, Australia's overall pretty much always ranks in the top 3. And when it comes to healthcare outcomes, it usually ranks at number 1. And importantly, and this was really the goal of Medicare, when it comes to equity, so making sure that people receive the healthcare that they need according to that need rather than their means, Australia, I'm always proud to say, comes out at number 1 as well. But, you know, we know there's always more that we can do. And we know we have a healthcare system that is under a lot of pressure. It's under the pressure of our demographics. We're getting older. There's more chronic disease in the community, more mental health issues in the community than maybe there were 20 years ago, let alone 40, when Bob Hawke and Neil Blewett were putting Medicare together. But we also know we're dealing with 10 years where the financing of Medicare's frankly been a little, a bit too low. And we've got the scarring of the healthcare system from COVID. So our focus last year was to inject some additional funds, particularly into general practice, which is the backbone of our healthcare system, triple the bulk billing incentive to try and stop that slide in bulk billing rates that we've seen over the last few years, but also to inject some real reform. I mean, I said at the time, I wasn't interested in simply putting more money into a system that wasn't meeting the needs of patients today. And frankly, as great as Medicare is, it was designed in a different era when the bread and butter of healthcare was quite different. Generally, it was episodic care for a one-off bout of infectious disease or falling off a ladder or your kid falling off the skateboard. We know now the bread and butter of healthcare is more chronic disease, and that needs quite a different type of wraparound multidisciplinary care. So last year's budget was about more money, but it was also about reform. And that's a journey that CHF must be a part of as well, so that we hear about how that reform, most importantly, is going to meet the needs of patients. Really pleased to say 12 months on that bulk billing has stopped the slide, and we're only 5 months into the new bulk billing incentives, but we've seen really pleasing increases in bulk billing rates across the country. In just 5 months, we've got 950,000 additional free visits to the doctor. So that visits which before November would have attracted a gap fee, now completely bulk billed or free of charge. Now, I want to see that rise even further. I want to see that continue. But really pleasingly for me, those good increases in bulk billing that we've seen over the last 5 months are particularly in markets that I was most worried about, where bulk billing rates were lower than the national average. So I'm talking Tasmania, rural and regional areas, Central Coast, Hunter Valley, New South Wales, just to name a few, has seen some of the better increases in bulk billing, and that's as it should be because they had lower rates. I'm also really pleased at how the urgent care clinics are operating. Already 400,000 fully bulk billed services where people are able to walk into a clinic when, as I said, kid falls off the skateboard, they get something in the eye, they have a laceration that needs stitching, and they're being seen pretty quickly, certainly far more quickly than they would have been at the local hospital emergency department, getting high quality treatment. I'm finding as I get around and talk at these clinics, people want to go and work there. Doctors and nurses are really excited about the type of work they're delivering in these clinics. So those clinics are not having much difficulty at all getting the staff that they need. And the feedback we're getting overwhelmingly is really positive. Really interestingly, particularly from parents. 1 in 3 of the people going through an urgent care clinic are 15 years of age and under. Clearly, there's a need out there. Saturday afternoon is very busy after kids get knocked over at playing sport, do their wrist or something else. So it's been a gap in the healthcare system here in Australia. I'm pleased that we've started to fill it. We've also getting some really good outcomes on cheaper medicines. The measures we've put in place already have saved Australians hundreds of millions of dollars over the course of the last 15 months or so, and those savings will continue into the future. And last week in the budget, is it last week? Yes, last week in the budget, we announced that we would freeze the price of medicines, so the co-payment, for up to 5 years for pensioners and concession card holders, and for 12 months for general patients who, it must be remembered, got a very big cut to their script price last year as well. So trying to find ways in which we can just help Australian households with the cost of living pressure that we know is still pretty acute out there, while also getting a good benefit from healthcare. We know that cheaper medicines is not just good for the hip pocket, it's also good for your health, because too many Australians feel that they can't go to the pharmacist to get that script filled their doctor has said is important for their health because of cost of living pressure. So we want to get that double whammy impact of a good cost of living measure for people's hip pocket, but also trying to make sure people are able to take the medicines that their doctors say is really important for their health. So in this year's budget, Elizabeth, your members will know that we're very focused on trying to get a new hospital financing deal done with the state and territory governments. We're busy in negotiations now. We are focused on trying to get that agreement by the end of June. We've said that the Commonwealth will put on the table at least $13 billion in additional funds. So that's additional to what the states otherwise would have expected to receive for their hospitals. But again, as I just described in relation to Medicare, I don't want that just to be more money going into the same. And I don't think state and territory health ministers want that either. We want to think about how we can get our hospital systems working better with aged care, with primary care, those connections between the two systems working in the best possible way. So that's why over the last few days I've been going around the country talking about the funding that was in last week's budget to help, frankly, the experience older people have with hospitals. So if at all possible, preventing them from having to go to hospital in the first place. Obviously, if they need to, they must. But often people can get good quality care in their aged care facility or in the home. And if you end up in hospital, you might be there for weeks or even months, and it's not always a terrific experience. It's also not an efficient way for us to run the hospital system. So we're trying to think about ways that people can get more virtual care. We're putting in place geriatric flying squads in partnership with states. So we've got geriatricians and nurses moving outside of the four walls of the hospitals into community settings to try and get to where the patient is and provide them with the best possible care. So I'm really looking forward to us continuing that work with state and territory governments. I have to say, having been around health for a while, all of you would know that for too long, it was like the Commonwealth was over here and state and territories were over here, and we sort of weren't really supposed to try to sort of have a view about how the others operated. There's much more cooperation now than I remember there ever being. And I think partly that's a product of COVID and our experiences in COVID, I think. But we also understand that the best way to get good outcomes for patients is by working together and trying to improve those connections. Some of the other things people might be interested in from last week's budget as well. We delivered a response, or I delivered a response to some work we've been undertaking with a whole bunch of groups in the mental health sector, including obviously consumer and carer representatives, to deliver a response to the better access evaluation. So how do we make sure that people get a level of mental health support that is appropriate to their needs? I mean, we need a much more stepped system than we have now, because we know in mental health there's a very wide variety of types of need or levels of need. And I think last week we delivered some important reform there that, for example, will ensure there's a national early intervention service. You see this around the world. The National Health Service, the NHS in Britain, has it called Talking Therapies, that people are able to get very quick access if they're experiencing temporary periods of distress or relatively mild experiences of anxiety and depression and need something quickly, free of charge, completely bulk billed. We'll build that service over the next little while as well. And in the area of women's health, Jed Carney, the Assistant Minister for Health, has been doing some terrific work. We know there's more to do here. We want to continue working in this space. Yeah, I think one of the things I was really proud of us announcing over the last couple of weeks was a properly funded consultation for women experiencing quite complex gynecological conditions like endometriosis, PCOS, chronic pelvic pain. I mean, the outrageous thing was that, you know, if I, as a middle-aged bloke, went to my cardiologist, that cardiologist would receive twice the Medicare rebate that a gynecologist would receive for a woman attending to see her or him for the same length of consult, a very complex gynecological condition. So we've doubled the Medicare rebate. That'll massively reduce out-of-pocket expenses for women with complex gynecological conditions. It builds on the long consult that we put in the MBS last year for general practitioners, recognising that the practitioners need to spend good time with their patients when there's a complex condition, and need to be remunerated appropriately for that. We put in place some foundation work, particularly to lift the capability of GPs and primary care teams around menopause, around reproductive choices, particularly targeted at the relatively low uptake we have in long-acting contraceptives here in Australia. That was certainly a key finding of a recent Senate inquiry into reproductive health. That's a foundational piece of work. We need to do more there. And I know we're very keen to work with CHF and with other consumer groups in that space, obviously women's health consumer groups in that space as well. Elizabeth, I might leave it there. Hopefully that's given people on the webinar a bit of a taste of what we were trying to do last week. Can I perhaps finish on this note? Having been around this area for a while and in politics for a while, it's really important, I think, we remember no budget is an island, and particularly not in health. I've said since I had the privilege of returning to this portfolio, the work of strengthening and modernising Medicare and other parts of our healthcare system is not quick work. It's going to take a while. It's going to require substantial investment from government, but partnerships with consumer groups and clinician groups to do the long, hard work of really reshaping what is a terrific healthcare system, but does need a bit of work to make sure that it reflects the needs of patients today or consumers today, and certainly the needs of Australian consumers into the future. So I encourage people to look at this budget in the context of the budget last year, in the context of the work that is still underway with a series of important reviews that I know CHF is participating energetically in. But I look forward to all of your questions and the rest of this webinar.
Yes, energetically indeed, Minister. You're very generous in offering me the opportunity to sit on committees and also engaging with other consumers, so that's terrific. So look, thank you very much for your overview of the budget. I hope you were seeing all the love on the screen there.
I haven't got my glasses on, so it's a bit fuzzy.
Oh, well, generally red's a heart, so that's a good sign, right? I can tell you that the most love you got was for the urgent care centres. Just, you know, some immediate feedback from the community. Second most was bulk billing, the improvement in bulk billing. A lot of other things got a little bit of love, but those two would stand out as the things that most people on this call today said were really terrific improvements. And the only thing that really got a bit of shock and dismay was when you were talking about the difference in billing between cardiology and gynecology, where people went, yeah, that's really terrible, so glad you're doing something about it. You didn't really get any thumbs down for anything you've done, so I think we'd have to give you at least a B+ for this budget, nudging towards an A. I'm a hard marker, right? So I want you to, you know, be aspirational for that A next year, but you're definitely getting up towards the A itself. Before we get to those questions, though, from people that we've got from people today, and we've got 13 more questions, keep sending them in, folks. I wanted to give you a bit of a sense about the feedback we've had so far from people from the budget. We ran a members-only webinar the day after the budget. Huge thanks to my team for turning around the entire budget in less than 24 hours to do that. And we've engaged in other ways. I think in the lead up to the budget, Minister, we heard really strongly from our members, so our member organisations, as well as the thousands of consumers that engage with us, that health equity was really important to them. And they do kind of expect your government to deliver on that. They understand that's important for you as the minister, but also more broadly for your government to deliver on health equity. They want that right to lead a healthy and productive life. And part of that might mean being able to access health care. So we can see, and you've shared today, that some of the measures in this budget do actually move us in that direction. And that's terrific. But we would say we can see there's other areas where there hasn't yet been movement. Noting your comment on can't build Rome in a day, we still would say there's still work to do yet, particularly around affordable care and accessible care for everyone. We're also hearing that people really want to see initiatives that allow them to improve their own health literacy, and there's not a lot of that in this year's budget. If you think about prevention as empowerment, so the preventative activities funded, which are terrific, are more about vaccination and screening than about empowering consumers to understand the system, to be health literate, to be able to advocate on their own behalf or on behalf of a loved one. So that's the bit for people saying, you know, we'd love some more of that, because that means that we can look after ourselves well. Dental, again, I know a difficult conversation, but as friends we can have it. People really want to see some changes in relation to oral care. We did a survey last year on this, and you know, you can really see that people who access public care generally do it because they're already in trouble. They access because they've got pain and so on. But people who access private care do it for preventative reasons. You can see that in our survey. So we really need to do something so that people are not using the public system because they can't afford the private system. People talk again about the need to be able to get access to a range of health professionals more cheaply. Great for bulk billing in general practice, but for allied health specialists and the like, wanting to know they can go to those places too. So I'm keen to understand, as I'm sure everyone is here, can you give us a sense, if we look at this budget and beyond, how your government plans to tackle some of these issues? Easy question, Minister.
Yeah, there's a lot in that, Elizabeth. So let me try and sort of triage, for want of a better term, some of that. I've got the great man looking over my shoulder because I'm in my electorate office. So sorry for a bit of sort of party political stuff. I inherited this terrific photo behind me of Gough Whitlam from my predecessor, of member for Port Adelaide, Mick Young. This dental issue has been an issue going back to Gough. As many of your members would know, you know, Gough took a decision not to include dental in Medibank. That not for as a never decision, but you know, frankly, biting off as much as even the great man could chew, given the level of opposition we had to the creation of Medibank, political opposition, but importantly, strident opposition, as you know, from doctors' groups and at that time dentist groups as well. Threatened a very long battle if we put dental into Medibank. Exactly the same thing confronted Neil Blewett and Bob Hawke a decade later. And so, I completely accept the position that dental not being in Medicare is a logical inconsistency, and was really a pragmatic decision taken by Labor governments who were fighting pretty much on every possible front to entrench universal health insurance. I really understand the frustration that people have with this. We have a Senate inquiry that I'm sure CHF has made submissions into oral health or dental care. There's also a piece of work that South Australia is leading for health ministers, our health ministers group, to look at options for dental care into the future. I'm not going to pretend this is likely to be something we are able to land in the near future, but our party, the last national conference in our platform, recognised this as unfinished business for a party that is as committed to universal health coverage as ours has been for at least 50 years. So I want to continue working with you on it. I recognise that it is a logical gap in an otherwise terrific healthcare system that we take some pride in as a Labor Party, but I'm not going to pretend this will be easy to land in the near term. I'm looking forward to these pieces of work, the Senate work and also the work that health ministers are doing together to see what we can do. I mean, it's only one part of the jigsaw, but the chronic disease, the childhood dental benefit scheme that Tanya Plibersek was able to put in place at the end of our last term in government, I know has made a real difference. It's allowed, as you would know, a bunch of the old school dental programs that had really been defunded to become resurrected. I know in a number of communities where households tend to be a little poorer than the national average, this is making a real difference. Clinics are opening up, able to access or tap into that program. So we know this can work, but I've tried to sort of be as frank and honest as I can that really I saw my job in the first couple of years as being sort of picking the existing Medicare system up off the mat and re-injecting some funds into it. In general practice, really sending a message to GPs and wannabe GP junior doctors that we valued general practice because they hadn't really been getting that message for a decade out of Canberra. But in time, we are going to have to come to the dental question. Look, on literacy, Elizabeth, I'm really keen to have a further discussion about that. I see when COVID had some what I would describe as sort of negative impacts around people's view of their health and, accessing information off the internet that is not always well curated and not always based in good science. But overwhelmingly, I think beyond that sort of relatively small, real problem that came out of that era, I think there is some positive you can take out of that. People became more literate about a whole range of elements of the healthcare system that they perhaps hadn't thought about as deeply before the pandemic. How do we leverage that? How do we build on that has been something I've been keen to sort of understand a little bit more. I don't pretend to have the best ideas about that. What are, particularly given all of the technologies at our fingertips right now, how could we as government help consumers lift their literacy, not just rely on Dr. Google, but curate this stuff well? That's something consumer groups talk to me about quite a bit. I think we need to understand, I'm sure you all do probably better than me, we need to understand that, we're not just dealing with the ubiquity of information from the internet now. We're moving into an era of artificial intelligence as well, which is a whole new set of challenges and opportunities from technology when it comes to healthcare. And so we're going to have to navigate that very, very carefully as well. And it's critically important that consumer voices be at the centre of that debate.
Great, thank you. Thanks very much, Minister. So I've got some questions and we'll go through them one at a time. We've got 23 more that have arrived during the conversation. So as I said, we won't get through them all, but we can have a conversation separate to this another day about the other issues people have raised. So the first ones I'm going to start with are around primary care, because I know you just mentioned that getting that Medicare system working is so important. But a question from both Tina and James about the urgent care centres. And they're wanting to know whether you've got a vision to expand these to include more than just general practice. So to include physio or specialists and other things, so people can go there for that care, noticing that people like it because it's affordable as much as it is because it's after hours.
Yeah. First of all, I think the critical thing here is to keep the focus on urgent care. And I'm sure your questioners recognise that as well. As I get around the country, different providers are doing a few different things. Some of them, for example, have access to urgent dentistry on site. Some of them have said actually quite a number of their presentations are oral, either an injury or something that's just flared up and needs urgent attention. Some others are talking about we probably underutilise physios in urgent care in Australia compared to some other countries. So some of those providers are thinking laterally about that as well. I think this is a new model of care for Australia. We're trying to roll out a fair number of them just to provide good service delivery here and now, but it's also a bit of a pilot. And I have used that terminology. There is money in the funding for urgent care clinics for an evaluation. We'll be deciding upon that through the usual tender processes. And I want to see what works. I mean, I want to get this right. I really think this is a good direction for Australia's healthcare system. And I don't just want it to be doctors and nurses. I think if we can find ways effectively and efficiently to have some of these other allied health services available to them, then I'm all up for that. It is already happening, not in huge numbers, but some of the more innovative providers who've been awarded these contracts are trialling some of this, and I think it'll be really important we include that in the evaluation.
Great, thanks, Minister. Now, Jan's got a question again, sticking with primary care, about how the budget is tackling equitable access to primary care for those who are really struggling with affordability. So these may be people who perhaps aren't on a healthcare card, but still the costs of their healthcare are really high. Can you talk to me about some of the highlights, I suppose, from the budget that are helping to address that?
Well, I mean, the first thing I would say is, the real cruncher for affordability was the freeze in the Medicare rebate for several years. That meant that primary care providers were sort of hanging on by their fingernails to sort of try and keep bulk billing up and to try and keep gap fees as low as they could. But if your income's frozen while your costs are going up, that's sort of pretty hard for primary care providers. And then the global cost of living shock hit. As COVID was winding down, as the Russian invasion of Ukraine smashed the sort of global energy market. And I think, frankly, a lot of primary care providers through that period just really struggled to keep their affordability controls in place, and you saw gap fees go up, you saw bulk billing start to drop. What we've tried to do, obviously, is target money into bulk billing. But we've also, over the last 2 years, increased it's important to get this number clear. The last two budgets have increased the Medicare rebate across the board, so not just for GPs, across the board. we've increased the Medicare rebate in 2 years by twice as much as the last government did in 9 years. So, look, it's not everything for primary care providers, but we really have tried to focus as much as we can on dealing with the cost pressures for providers, because ultimately they just flow the impact of those cost pressures onto consumers. We've also indexed some of the non-doctor services for the first time in a long time. Nuclear medicine has been indexed for the first time in, I think, 25 years. They'd been really complaining a lot, the providers, about cost pressures, and they were going to have to start to pass that on to consumers. We've indexed particularly the labour-intensive pathology groups, so tissue pathology, some of the other areas, for the first time in 20 years. We're delicensing MRI machines in the big cities. We know from our experience of having done that in the rural communities that increases bulk billing for MRIs, and it reduces out-of-pocket costs. So, we're trying to do what we can to relieve those cost pressures that built up over a decade in the healthcare system and ultimately flow onto your members. One of the areas I have to say I'm pretty frustrated about is specialist out-of-pocket costs. They are substantial. They've grown very substantially over the last 10 years. And there's not a lot of line of sight about this. So, my predecessor, Greg Hunt, put in place the medical cost finder, try and let sunlight in, and maybe you'll get some change in behaviour so that people could go and search what their specialist A, B or C were charging by way of out-of-pocket costs. And I think at some point when we looked in the last 12 months, I might get this number wrong and I apologise if I do, but 9 specialists had registered in the medical cost finder. I mean, that's not a system that's working. So I've asked my department for alternative ideas there as well. Ultimately, again, what I use this term triage a little bit already a couple of times in the webinar. What we've tried to do is there are all these pressures, cost pressures, workforce pressures in the healthcare system. The best thing we can do, I think, is try to work out what the most effective things are that we can do in the immediate term, and then sort of keep working through the list. So again, that's why our engagement with you guys is so important, because you're at the coalface. What's really hurting consumers. What's really making those critical decisions about whether I go and see someone or don't, because of the household budget pressure that people are under. So keep your feedback coming in. This is how I've tried to order things. If you think there are things that need to be pushed up the queue, I'm all ears, frankly.
Thanks, Minister, for your really thoughtful answer to an issue I know is really dear to your heart. And now we're going to move to another area that you're very committed to, which is mental health. We've got a few questions about that. So the first is the funding of the National Mental Health Commission. So we've had quite a few people, Gwen, Alex, Belinda and others, ask, what is the future for the Commission? And in closing yours, do you think it could have a knock-on effect to the states and their commissions?
Well, the last thing I did in relation to commissions did have a knock-on effect in the states, and it was a good one, because I introduced the National Mental Health Commission over a decade ago with Julia. And this was part of the biggest mental health spend in history. It wasn't much money, but geez, it was something consumers talked to me about all the time as I was going around the country, talking to them about what the focus should be of our mental health reform package at the time. And the reason they gave for this being important was that they wanted a body that was at arm's length from well, at that time me, or ministers and departments who could report without fear or favour on how the system was changing their lives, or more importantly, not potentially changing their lives. They wanted transparency and they wanted good reporting. And that's why we introduced the National Mental Health Commission. put together a very good group of commissioners. Sam Mostyn was one of the first commissioners that I appointed, who is going to be our new Governor-General on the 1st of July. A bunch of other people as well. It was a terrific group. Alan Fells was the first chair. I've got to say, I think somewhere along the way, the Mental Health Commission lost its focus on that core job, and it wasn't their fault. They were being commissioned by government to do different pieces of work, program design, sometimes even some almost not service delivery, but program delivery at least. And there was, as people know as well, a review of the Mental Health Commission, which delivered its report to me recently. So the decision I've taken is that we need to not quite start again, but have another process of consultation with stakeholders about the future of the National Mental Health Commission. I wrote to stakeholders, I think, last week to start that process. I've made it very clear my view about the importance of the Commission has not changed in 12 years, and my view about its core role has not changed either. I'm open to different suggestions, but I want to see a Mental Health Commission that is independent. I'm pretty open about what form that takes. I've said, for example, I'm up for a discussion about a statutory authority. I want to see it continue to have an independent role. Its functions are going to be brought back into the department while that process goes forward. But from my point of view, and I try to be clear with the stakeholders I've written to, I want to get back to where we were 12 years ago. An independent body reporting without fear or favour on how the system is changing people's lives and whether taxpayer investment is doing what we all intend it to do. And I look forward to that discussion. After we introduced the Commission 12 years ago, people are right to say that a number of other jurisdictions followed our lead and put in place mental health commissions. If any state or territory government is under any misapprehension as to my intention into the future, I'll talk to them. Like this is about regrouping for a body that is critically important. It's such an important confidence measure for consumers and carers. We've got to get it right, and it sort of just got off course for a while.
Great. Thanks, Minister. Another mental health question. I know you've been reshaping better access since you started with your evaluation and changes. And in this budget, you opened that up to referrals to other practitioners, not only psychologists. People are interested to know, well, who might they get a referral to then? Are you thinking credentialed mental health nurses, social workers, others?
So there are a few things in the budget around that. Firstly, I mentioned the National Early Intervention Service. I mean, that service is likely to be, we're still going to design it, but likely to be delivered by counsellors, social workers, people with very high levels of capability in the area that we're focused on there. There's also money in the budget to really try and get some structure around the important peer workforce in mental health. I've been working in and around mental health for well over 2 decades, and I've been to services where peer workers, people with lived experience, are utterly central to particularly psychosocial services. And so it's been a bit haphazard how we utilise them, how we evaluate that work and make sure that we're getting the best use out of peer workers. So a peer workforce association was funded in the budget, and some more work there. So that's another element. The other really important element of the budget was to allow primary care providers, particularly general practice, to pull together teams of people to wrap around someone with a chronic mental illness. So this is the approach we want to take for a whole bunch of chronic disease, whether it's diabetes or cardiac disease, or mental illness for that matter. So people might remember out of Strengthening Medicare last year, PHNs or primary health networks were able to commission services into general practice. We wanted that to be pretty innovative, so looking at social prescribing and things like that. In this year's budget, we've got, I think from memory, $71 million for general practice to tap into PHN services. So mental health nurses are a terrific way to, hold that wraparound service together. Mental health nurses over many years that I've been working with them, going back actually over 30 years when I started working with what we used to call back then psych nurses. The first psych nurse I worked with, he actually gave me my first job a little more than 30 years ago, interestingly with Julia Gillard's dad, who was a psych nurse at one of the big hospitals here in Adelaide. They aren't used as much as they should be in primary care anymore. We used to have the mental health nurse incentive program that got folded into the flexible funds that primary health networks now use. Frankly, some PHNs still use mental health nurses really well, others don't. And I want to lift that work. Social workers doing some of that wraparound work as well. So again, I don't have a fixed idea about where the limits of this are. I want a level of innovation here, as I did last year for other chronic diseases. I've also said that people with chronic mental illness should be able to be referred by their GPs, not just for the psychology sessions in Better Access, but also for physical allied health. We know that too often people with serious mental illness don't have their physical health looked after as much as they should by their treating healthcare professionals. They're not getting their lipids tests, they're not getting their blood pressure tests. A bunch of those things just sort of fall off the edge of the table in the limited time people have that ends up being devoted entirely to their mental health issues. So hopefully that gives you a bit of a sense. Again, I want to see innovation. I want to see what works. And I've got a pretty broad view about what group of workers should be picked up by that program, Elizabeth.
Great, thanks, Minister. So now we're going to move across to prevention. And we're a bit like what we're hearing about the Commission. We're hearing some early signs of concerns from communities and consumers about what's happening with the Australian Centre for Disease Control. So it was in the budget last year. People would really like an update. What's happening in relation to the CDC?
So we're still very committed to the CDC. We had substantial funds in last year's budget to fund essentially the foundational work of the CDC. So there's an interim CDC that's operating now. It's operating inside the department while we work out what the ultimate structure of the new entity is, what type of sort of legal entity it is under Commonwealth legislation. I've taken a view that it's important. So people will know we've got a COVID inquiry underway right now that Robin Cruck is chairing for us. That is due to report to government in September. I think you don't have to be a rocket scientist to realise that inquiry is going to reach a view about a range of things that go pretty squarely to the role of a CDC. I mean, I think probably the first important role of a CDC for mine is how we share data in the healthcare system. And when I came into the job as health minister, I couldn't get good data on who was dying from COVID. I couldn't get data on the number of people who were dying each week who were vaccinated or weren't vaccinated. I couldn't get data on number of people dying who were Indigenous or non-Indigenous. I mean, pick your data point. We're just not good. And that was sort of 2 or 3 years into the pandemic where we had started to build some systems. We've got to get better at how we use data, how we notify of diseases, how we act quickly on those things. And I think the COVID inquiry is almost certainly going to provide some recommendations and insights into that. So I think to circle back to CDC, I think we want to we want to make sure that as we take the next steps around building the CDC, that we do so with the benefit of the Cruck inquiry's recommendations, which, as I said, won't be delivered until September. Meanwhile, the work goes on. We're working with states and territories to make sure that the CDC has their buy-in, because without their buy-in, it would be a pretty useless CDC. And into next year, I think we'll be in much clearer shape.
Great, thanks, Minister. Claire and Alexander have asked about prevention, particularly the big strategies that the government has completed. So the preventative health strategy and health literacy strategy. Got these strategies, but at the moment, as we understand them, they're not resourced for implementation. Can you give us a bit of an update about how those good pieces of work will move forward in the coming year?
I think that's a fair comment to say that in the prevention space, I think a lot of my attention and energy have been focused on two important pieces of work. I will say that we've funded a lot of sport activity, which did not have funding allocated to it before last week. That is obviously a particularly important part of our preventative health program, which is why sport sits within my portfolio. But the two pieces of work that we've really been focused on, or three, I guess, over the last little while, have been reigniting the fight around tobacco and the new fight against vaping. And I want to thank all of the consumer groups who've lent their voice to the need to pass these world-leading vaping reforms. So updating the tobacco laws, which we did late last year, doing the vaping that we're doing this year that's already having an impact, was one piece of really important preventative health work. The other, which I announced last week, that was very much community and consumer-led, was our HIV response. So very big funding in there for prevention, particularly for Medicare ineligible residents of Australia. So many of them will be skilled migrants, overseas students, who are an increasing share or number of new HIV infections. This is part of our determination to end HIV transmission by the end of the decade. We could be the first country on the planet to end this 40-year epidemic. I was at the scientific conference in Brisbane last year of the AIDS Society, which is held every 2 years. We hosted it in Australia last year, and that heard a report that in the inner suburbs of Sydney, HIV transmission has effectively ended. So the part of our country that bore the brunt, the death, the dislocation, the stigma, the trauma of the early years, in particular of the epidemic, has effectively ended the epidemic, which is just such a wonderful thing to be able to say, but the rest of the country hasn't. And we're determined to try and change that. And what I heard from the rest of the world is that the rest of the world expects Australia to be the first country to end the epidemic. That's the quality of our HIV response over 40 years. And the rest of the world takes the view if Australia can't end the epidemic, they're not sure anyone can, which gives you a sense of real responsibility as an Australian. And so we had a task force that I chaired with HIV groups. The degree to which the HIV response has been consumer-led. In many ways, it's taught us in other areas of health how to do healthcare well, how to do program design and delivery with consumers at the heart. In many ways was informed by the quality of the HIV response as it was built through the 80s, through those really difficult years. So that has taken up a bit of my time in prevention as well. I think it is legitimate criticism to say I haven't done enough in these other more general areas. I'd like to continue to have discussions with CHF about that. Sort of brings us back to, I think, your first question, Elizabeth, around literacy. I'm very keen to get more of a sense from you guys about what we could usefully do there. It's not something I have well-defined views about yet. So I'd look forward to a further discussion about that.
Right, you've segued very nicely, Minister, into the next question, which is from Mitch, which did talk about the LGBTIQA plus community and asked, great work you've done with HIV/AIDS. Is there anything likely to come up soon in relation to the trans community? Because that's one that we didn't see get much attention in this budget.
Yeah, thanks, Mitch. And this is work that Jed Carney is particularly deeply involved with, developing the action plan or the 10-year plan for LGBTIQA plus health, working really strongly with the consumer groups in that space. I was able to spend some time with those groups in Canberra a few weeks ago and got a real sense of their ambition for that to be landed. I think that work's going really well. It's well resourced. I don't have a sense of ultimately what it's going to decide upon, but we think this is work that has been underdone over the last decade, and we're determined to give that community a sense of how highly we value their place in healthcare, how deeply we recognise some of the particular challenges, ongoing stigma and discrimination, not just in the community more broadly, but in healthcare too often, that members of your community have faced. So this is important work. It's work that I have a history with. When I was in the aged care portfolio, we worked very closely together to put together the first LGBTIQA plus ageing strategy that led to some really good change in the aged care sector and program delivery and things like that. So I want to see that happen more broadly across the healthcare space, and I know Jed is passionately committed to this and frankly getting a lot out of this work. She's finding it really rewarding. It's there's a lot of goodwill in that group.
Fantastic, Minister. You'll be pleased to know the grilling's over, though you've done terrifically well. Yes, I noticed the emoji love has definitely slowed down. So for those of you in the last couple of minutes, if you want to send some love to the Minister, do feel free. We've probably got about 40 questions that we haven't had a chance to answer today, Minister, but we will work with your office about a way to share that with you so that you can see the questions. For anyone who hasn't put their question in, you've still got a minute or two before the Zoom closes. You're definitely getting a bit more love now. I really like to thank you, as I often do, Minister, for your transparency and openness. I mean, people are generally very supportive. You can see that through the love you're receiving now of the work you're doing, but they're doing it hard and they want to see more. So I suppose as you go into an election year, people want to see more is a good message to get. I'd like to really thank everyone who's joined us today for spending some time on their Friday with us, sharing their ideas, sharing their emojis. And these opportunities, as you know, are really important whenever we get the opportunity to have ordinary folks come and talk to you about your work and what they'd like to see going on. I think it's so important for us to be able to do that, and it's a great privilege for us to be able to make sure that people hear their voices, you get the chance to hear their voices. Just a little plug, in a couple of weeks, we've got a webinar on AI in healthcare with a great panel. So those that haven't registered for that might like to. You can go to our website and there's a link there for you to register. It'll be a really terrific session. And there's so much change, as you mentioned, Minister, and so important for consumers to understand it. And for those that aren't connected with us, we've got our newsletter, we've got lots of things happening in social media. That's a really great way for you to know what's going on. And once again, Minister, thanks so much for sparing some time for us today, for the great overview you gave us, and for continuing to work on behalf of all Australians to improve their healthcare experience and their health and wellbeing. Thank you.
Thanks, Elizabeth.
Okay, bye, folks.